I want to bring in Dr. Brianne Slay into the conversation, a psychologist and executive board member of the Missouri Association for Early Childhood Mental Health. Welcome to the show, Dr. Slay.
Glad to be here.
All right, so share with us about your experience with young kids and self-diagnosing mental health issues on TikTok.
Yeah, I was working in a psychiatric inpatient facility this past summer for young children and adolescents, about 14 or 4 to 17 years old. And we were seeing just a large amount, kind of all around the same time, of kids coming in being very confident about their diagnoses, saying, I have these sorts of things. I have ADHD, I have autism. Or either using pretty clinical language to describe certain diagnoses leading up to something in particular, ADHD, autism, or describing alters and how they have different personalities and being very detailed in describing these different personalities. And a lot of them were referencing social media, saying they saw these different videos on TikTok and that's how they know that they have XYZ diagnosis.
Well, I mean, it makes your job more difficult. You actually studied these videos, and what you saw, I mean, were they far off from the actual symptoms that patients might experience?
It was a bit much, and I ended up deleting my TikTok the same day because it was a lot to look at. But it's difficult to diagnose based on 3 or 4 different symptoms in a 30-second video. And so, though it may be true that having trouble with concentrating or forgetting things or time management is involved in ADHD, those symptoms in and of themselves don't make a diagnosis. There's a bigger picture and a lot of context that goes into that as well.
You think TikTok is doing more harm than good?
I think it's, like Dr. Sportelli mentioned, I'm glad that we're getting rid of the stigma, and I'm glad that more people are open about talking about mental health and sharing their experiences. The tricky part that comes in and where it can be difficult is if we're kind of clinging on to these diagnoses and then like wanting or sort of expecting certain treatment or certain accommodations or certain things like that because of those diagnoses. And it's really important to kind of go through the proper channels to get a diagnosis.
Yeah, well, and what do you suggest, Dr. Slay? What do parents need to know? Because obviously if kids are participating in this type of content on the internet, I think parents need to do something. So what are your suggestions?
Yes, absolutely. I think the biggest thing that parents can do is first listen. Your child wants to be heard. Kids want to be able to express what's going on. And so taking the time to really hear what they have to say, not in a defensive way and not to challenge it, but just to understand what's going on. And then after that, getting an idea of, well, how long has this been going on? How much of it is troubling you? And how do we work together to figure this out? And that's going to be speaking with a licensed mental health professional.
Gotcha. All right, Dr. Slay, thank you so much. Great, important discussion. Thank you for your insight.